without a waste of time, I'm going to invite Honorable Dhlomo to give the opening presentation on his committee issues. Yes. You can come here for the initial presentation, but when we deal with the questions afterwards, we can take them from there.
Okay. Thank you very much, Mr. Mloto. Good morning to our media houses that are invited here, to our staff members of parliament and the stakeholders who are here invited. Recognition to my two chairpersons that I have already greeted outside, but and also got a bit of a directive that because this is a month of women, Honorable Maimela will speak last, and we then agreed that she will take almost all of our questions because it's a month of women. We must give the recognition to that. I will probably deal with two items, but the third item might just come in because it's topical, the issues of NHI as an act. Of course, part of it in terms of explaining the issues of what has been happening with Dudula will be touched on that. Let me just start with the process that is Tobacco Products and Electronic Delivery Systems Control Bill. This bill was actually brought into Parliament in the 6th administration. Actually, I was privileged to have brought it myself as a Deputy Minister then to the Portfolio Committee on behalf of the department, having gone through what it has actually supposed to Cabinet, and then NEDLEC, and then came to Parliament. So the process started in 2023. At the completion of the 6th administration, the Portfolio Committee had not completed the process, had done public hearings on 7 provinces and had left with 2. So in this new administration, as a chairperson, I led a committee that completed those 2 other outstanding provinces. We were doing 4 meetings per province. And there was Northern Cape and Western Cape that had 3, so we had to complete one each. So that process has now been dealt with and is behind us. While we were going into the provinces, we then learned that there were about 60 organizations, institutions, and individuals who had requested to make oral submissions to the Portfolio Committee in the meetings that we normally have thereafter the public hearings. That process then kicked in, and next week we'll be completing this. In fact, if you release me much earlier, at 3 o'clock today, I start with that process of virtual meetings. We are going to listen to 5 other institutions today, and then we'll complete that process hopefully by Thursday next week. So we'll then be having all that part sorted out. What will then unfold thereafter will be the Department of Health to say, Department of Health, come and actually indicate to us what are your responses. Because all along we have been with them in all these public hearings in provinces and also with these ones. They have to actually now indicate what are their responses in the light of what we have been hearing. We will then, having listened to them, get into the process that is called clause by clause, looking into the bill in the month of September, clause by clause. So we are almost like panel beating, finding the views of South Africans and those who have participated, actually, because the product that was brought to us by the Department of Health will probably be amended through these contributions and suggestions by our citizens, and hopefully by the end of September. This bill should then be ready to be taken into the House for debate and also then be voted on for or against. If this bill then gets voted in as supported by the majority of members of Parliament, National Assembly, will then take its route into the National Council of Provinces for that other process. So really a bill that has been in Parliament since 2023 and is really urgent, because some of the people we have met are saying, please regulate us. We need to be regulated, mainly those who are in vapes, because partly this bill is improving what is there about tobacco, cigarettes and all that, but it is actually a new thing that we have never seen before, issues of vapes, hookahs. This act that we have does not cover that part. So we are looking forward to really fine-tuning this bill so that we can begin to really get into regulations of these vapes and other hookahs. Right now, we just leave them as they are. Nobody touches them. They do as they wish. And I think that is something that we need to be dealing with that very strongly. Now, let me then go into the second part, which is really dealing with the issues of not only Dudula, but generally speaking. When you look into the preamble of our constitution, it talks about South Africa belongs to all of those who live in it. Now, that part to be respected and that part to be acknowledged, but this part all, how many and who's all? So I'm not a lawyer, so I won't get into that. It could actually be argued. Then Section 27 of our Constitution again talks about everyone has a right to health care services, including reproductive health care. We were confronted by many stakeholders during the NHI public hearings on that part. And hence the conclusion of that part was to say, but the country will and should give emergency health services, not what will be for all South Africans a comprehensive healthcare services. So it means every citizen coming into a facility, citizen of the world, can only be afforded emergency medical services, which is probably what is binding us based on United Nations rules and all that. But the comprehensive part is that is not probably where we come in terms of support and to deal with that part. So I am glad that over the past few weeks, the Minister of Health has been discussing with the concerns of Dudula and other stakeholders who have brought this matter to our attention as a country. And our discussions, and also which then have come to be done by myself and the Minister of Health, is that these concerns cannot be ignored, brought in by these citizens. These concerns cannot be wished away, but maybe we should find an approach to handle them and going forward. And the discussion, therefore, going forward are, among other things, to address those issues. Fortunately, I was speaking to the minister who has just been a Minister of Home Affairs in the previous administration, and he mentioned the following, that there are certain acts that needs to be repealed, but bringing a bill into Parliament from the Home Affairs Ministry. One, a Citizens Act. I won't go into details there, but it means that part of that act talks about citizens being a very wide spectrum. I mean, South Africa is this side of a country. You can't have citizens of the world accessing services in the country the way. So that part must actually be looked into. The other two, that one was 1993, and the Refugees Act of 1998 also needs some repeal through the bill. There's another one called Identification Acts. I don't know much about that. I was trying to speak to my Home Affairs chair this morning, as to where these acts, what is the content of these acts? But I'm just raising it because the media might go and look and see what are these acts. The last one is Immigration Act. So some of these acts are very wide and encompassing what some of the people are in their views are saying. Maybe they should actually have a bit of limitation. we would have, it's not possible for us as a country to have unlimited resources to deal with what is there in the world. But however, the engagement with Tutula and other stakeholders to say, look, while there are concerns are coming in from this background, to say, because it's true that there are sometimes, look at clinics and hospitals where there's not enough medication, this and then long queues. But the other thing that makes us to say, maybe let's actually streamline the approach. If there was to be a fire in any of our informal segments, God forbid, but we also know that every time there's another fire, this and that, most of those citizens lose their identifications, their IDs and everything. So you'd also be saying to other South Africans, who are legitimate South Africans, you don't have access into this facility unless and until you produce an ID. It doesn't matter your ID was burnt in the fire last night or last week. So in terms of that, therefore, those are things that if you engage with Tutula and other stakeholders, you then find a process to say, let's start. So it is something, because as healthcare workers, they can't just stop today. We don't take you unless you show an ID. On the basis of what I've just said, there could be as well another South African who is legitimately supposed to come in there, but the ID is not there. But number two, this part that is this person, foreign national coming in for the emergency medical services, me at the gate, I may not be able to ascertain that part. But let me end with this part. Even us as South Africans, until this NHI Act gets to be really moving, there's only two groups of South Africans who are actually getting free medical services. It's what was announced by President Nelson Mandela in 1994 in his very first State of the Nation, where he says, one, all pregnant mothers will access primary healthcare services free of charge. All children under 6 years will access primary healthcare services free of charge. And we can tell you of the huge benefits of what that has done in our country. But all of us, until we have really put all the issues that do with NHI, we still have to go to Chris Hani Polakwana and pay if we actually are able to pay and we are working and pay for the service that we receive. But even if we have now got an NHI in place and we say it's free, it is free at the point of service. There are South Africans who will contribute to the fund and NHI, so there's nothing completely free. It is free at the point of service that will not disadvantage South Africans who will come at the point of service. But all of us will have to register, give support, and therefore be able to contribute to the fund. All that it will happen now that at the point of service, I will not have to, I'll have to produce my ID to say we are sponsored in Dhlomo. Yes, we are registered. Now get in there and then you get the service. So we'll still have to actually do that. So you may just say NHI is coming in for free health services. Yes, at the point of say, but there are South Africans who are going to contribute through tax to make sure that we realize a universal health coverage for all of us in the country. Thank you very much.
Thank you very much, Honorable Chair Dhlomo. I wish now to invite the Honorable Chairperson of the Select Committee on Education, Sciences and Creative Industries, Honorable Ben, to give a presentation on behalf of this committee.
Thank you, Chairperson of the session. Let me take this opportunity to greet the media house, the staff, Parliament, the stakeholders that are within our midst, also those who are in our different social media platforms, and also my two honorable chairpersons that are within our engagements today. Let me take this opportunity once again to extend also my greetings to all South Africans who are with us. Today, Honorable Chairperson, as a select committee of Education, Sciences and Creative Industries, we are here to clarify, indeed, and also just to brief in terms of the statements that we have echoed around the operations of Operation Dhlomo, specifically on the question of the threats that they've made to our future, which is our kids, when they were threatening that they are going to make distractions in our 2026 school year. We as the select committee are very clear that we will never accept that kind of distraction to take place. We do not believe that when you want to make things right, it's the way of an approach. We therefore condemned with the utmost contempt those forms of threats and actions to be. We are convinced that there is nothing that can be gained through those forms of actions, but there must be ways of ensuring that there is a cooperation. It is informed by our understanding, indeed, of what becomes the role of a civil society organizations. Because if you're identifying yourselves as a civil organization, you must be able to understand your footing so that you do not violate the rights that have been entrenched in the Constitution of the Republic. South Africa is not a banana republic, but it is a constitutional democracy governed by the rule of law, which is my former chair, when he was making a presentation, highlighted that our constitution is the supreme law of this land. This is Section 2 of that of the Republic of South Africa. Then what becomes the role of these important civil societies? It is to safeguard, make sure that it protects and also act as a watchdog of those rights. Make us as politicians to be accountable to that constitution. So this approach, that is why we're saying that we do not agree with this approach. How are you defining, how are you identifying a child that is not documented or is illegal in this country? Because an undocumented child, as already been highlighted by Doc, is not automatically illegal to this country. I think you didn't do that if you are just going to take a blanket approach of distraction. As has been highlighted by Doc, that there are the various issues that led to those kids not to be able to have those necessary documents. You can name them. It's a plethora of those issues that can be highlighted, but the simplest one is highlighted, not to lament. It's when documents are banned or are lost. There are processes that must be followed in order to ensure that you get your necessary documentations. So at the time when you are embarking on that destructive and unwelcomed behavior, as highlighted, how are you going to identify that? We don't know. Hence, we're saying that That is not going to be the case. We're not going to allow anarchy to coexist with governance. If any form of anarchy, as this operation Dhlomo is highlighting, they are prepared to continue with that, even though we are extending a platform to say, let us engage, let's sit down, because there are different approaches in anything if we want to cooperate and contribute to this constitutional democracy. So we are putting ourselves so that we can be able to engage with them. Our kids cannot. We are not going to allow that to happen. About, if I'm not mistaken, 6 million South Africans that are legal. I'm talking about those that are South Africans and do not have these necessary documents, not because they are not South Africans, but they do not have these documents. How are you going to separate them if you are going to say that at the point of entry you just dismiss everyone that is suspected? Because you will be using now a funny approach of sniffer dogs, because there's only sniffer dogs that can sniff the illegal substance at airports. So we are not going to allow that kind of a behavior. We believe that there must be processes, there must be engagements so that we come to a proper solution. So that 6 million that we're talking about, it's about 11% of the population of this country. I'm not talking about those who are here for different reasons. I'm excluding. I'm not talking about those. I'm talking about only South Africans now. Only South Africans. So it tells you that we have challenges, but government is dealing with those challenges. If you're talking about the question of borders, there are legislations that are dealing with that. The question of immigration, the question of following up all of these critical issues that have been highlighted. You see, and also the new legislation that we have just passed. I'm not going to be expatiating on it, but those that are dealing with the governing of our schools, Bella Act is clear on undocumented kids. We're talking about the future of this country, talking about the government that is looking after the future of this country, that must not at any given moment find violated, because it's a violation of those children's right, regardless of how are they in this country. Bella Act is informed indeed by different court judgments, court orders. So as people, as citizens who are respecting the rule of the law, we embarked on this process of ensuring that there is one legislation that governs our schools. So I'm inviting Dhlomo people to familiarize themselves with what is constituted by the legislation, what is constituted by our law. Specifically, they must visit Bella Act, so that they can be empowered. We are here for that. We are going to assist them so that they understand all of these issues that we are raising. We must not even be seen as people who are undermining or trying to be a stumbling block on the general role of civil society. We are clear and we are welcome, as it is also protected by the Constitution, because We want to have those watchdogs so that we do not by any means undermine or find ourselves not implementing what is expected in terms of the Constitution, but we cannot at the same time allow that. We cannot allow anarchy. Therefore, we are saying as a standing committee, if they want to contribute to this, to the building of this nation, they must come to the fore. We are not going to sit down and fold our arms. If they are, the established structures, they want to know how to participate. We are here. We are going to assist them. We will be part and parcel of ensuring that the role that, especially this month, is the month of women. We cannot undermine and neglect, the role that has been played by our forerunners. I'm talking about Mama Lini Ngoyi, Itamdwana, Winnie Madikizela Mandela. They created conducive environment for our kids, the future generations to come, to be protected, not to be violated, because the threats on its own to us, it's not seems to be comfortable or accepted. Instead, they must protect those kids. We are not saying that if there are criminal elements that they are identifying who are in the process, they must work with the security agencies. They must bring those to the books. We are not talking about that. We must not be seen as or misunderstood to be protecting any of those criminal as a criminal, regardless of documented or not documented. It must be brought to books, but there are necessary agencies that must work with. Cooperation in this instance is going to assist all of us. That's what we are saying as the select committee, specifically around this question. Thank you very much, Chairperson.
Thank you very much, Honorable Feni. I wish to invite the last presentation from the Honorable Chairperson of the Portfolio Committee on Basic Education, Honorable Maimela.
Thank you very much, Chairperson of our session. And let me stand on the established protocol and pass warm greetings to the members of the media that are here, the stakeholders that have joined us, our support team in Parliament, and of course, the fellow two chairpersons that have presented before you. As already alluded, my name is Joy Maimela. I'm the chairperson of Basic Education. And we consciously took a decision to elevate two issues that we felt it would be important that we address today. One of those issues, of course, is the BELA regulations. As the members of the media and the stakeholders would have seen that the Department of Basic Education has finally released or gazetted 2 regulations out of 8. And of course, they've generated serious interest. They've also generated serious interest from ourselves because, as we all know, the intent of the Act is to really ensure that there is accountability because the Act speaks to the roles of the SGBs. It is also to ensure that there is equality and equity in access to education because the Act speaks to admissions, it speaks to language policies, it also speaks to discipline in schools. Now, we have expressed discontent with these regulations. And of course, as a portfolio committee, we've actually been outspoken about this discontent with the gazetted 2 regulations. The first issue, or the first area of our discontent, is the fact that there's only 2 set of regulations that are released, and out of 8. And our view is that releasing these regulations in such a manner, it's going to create confusions, because the regulations speak to each other and they should correlate each other. And if you release them in 2 sets, for us, you are actually trying to derail the implementation of the Act in its totality, but also you're just trying to create some confusion. Moreover, because the department missed its deadline for the release of these regulations. The deadline was June. We are now in August, and they're only releasing 2. So that is the first concern that we have raised as a portfolio committee. But beyond that, we've said and we've communicated that we're inviting all stakeholders to really engage with those regulations. The second area of discontent is that on admissions, for example, the regulations refer to considering the demographics and education needs of the surrounding community. In the Act, however, in the Act, the responsibility for admission policy is actually given to the head of department. And the Act refers to the education district. However, the regulations now introduces what they call feeder zones, that the HODs ought to determine the feeder zones. And we believe that that is not in line with the essence or the principles of the Act, and that potentially reinforces local demographic homogeneity, contrary to the type of inclusivity that the Act intended. The second issue that we really are discontent about is the fact that prior to the release of these regulations, the department tried to enact something called the guidelines. And in our discussions and our meeting with the 9 PEDs over the past month, the PEDs, 8 out of these 9 PEDs also indicated that this is creating a confusion, and many other stakeholders have come to us to say this is creating a confusion. We have warned as a portfolio committee that the executive should not utilize this enacting of regulations to try and win certain things that they could not win during the public participation process. So there's certain terms that are introduced in these regulations, which are terms that were rejected during the public participation process. And in our own view, that is utilizing the regulation process to try and get other things through the back door by the executive. And we've actually called out to stakeholders to engage and comment on these regulations thoroughly. The other issue, which for us is quite a concern, is the Grade R infrastructure and funding as a critical agency issue. The Act makes Grade R compulsory. And as a result, we have said to the department they ought to come before the committee to actually take us through how ready each and every PED is for the implementation of the Grade R as a compulsory grade. We then, out of those engagements, we realized that there is serious concerns, or there is a serious backlog with, one, the infrastructure of Grade R classes, but also the material, the budget availability, and as well the teaching personnel. So you've got a lot of teachers who have been teaching Grade R, but they don't have the necessary qualification. And we looked at the plans of the PEDs in terms of capacitating these teachers, and we raised a serious concern about the pace, but we also raised a serious concern about ensuring that the Act is actualized in terms of the Grade R capacitation of the practitioners and also the teachers. We are then, as the portfolio committee, making a call to the PEDs and to the department to ensure that they finalize the last set of regulations as soon as possible, but we're also making a call to them to really review the 2 regulations that they have gazetted to ensure that they are really in line with the Act as passed by Parliament. Now, as we move to school safety, we have, as of course, parents, stakeholders, we have noticed that there is many instances of bullying in our schools, violence in our schools. We have seen many social media videos circulating where teachers are being threatened by learners or learners are threatening each other. And that is a great concern for us as a portfolio committee. We've held 2 meetings already, joint sittings with the portfolio committee of police and to engage on how do we improve the school safety. How do we ensure that schooling environments become really conducive? They become safe spaces for our children, because what we are seeing, of course, it goes way more or way beyond what you would bring as just a set of standard, a set of rules, because of course there is various interventions that we were given an account of, interventions like searching and seizures in schools, but also engagement with learners on how to ensure that we deal with issues of bullying, but also addressing violence in our school. But we're saying that it is becoming a serious problem, and it is a problem that we are going to further engage with the department on how do we comprehensively deal with it, because it requires us to bring the communities, to bring parents to the table. What we should know is that the school environment mirrors the community outlook. So in other areas, because of the levels of crime in the community itself, that crime escalates and it comes to the schools. So we have engaged with the department, but we're making a call to all stakeholders that this is a conversation that we need to have more comprehensively so that we bring a solution that is sustainable. I just want to speak to the few videos or the few reflections that we've made, that in this month, when we celebrate Women's Month, we're confronted with social media videos of boy learners violently assaulting a girl learner in East London. And this follows hot on the heels of the Minister of Basic Education and the Minister of Police signing the Safe Schools protocols in June this year to enhance safety in our schools. This protocol signifies a joint commitment to creating safer learning environment, addressing issues like violence, crime, and insecurity within our school. Now, as a committee, we call on the National Department of Basic Education to work closely with provincial education departments and law enforcement agencies to strengthen measures that ensure safe schooling environments. Key interventions, including the expansion of school safety committees, collaboration with community policing forums, and the integration of psychosocial support services for learners will be very important. We recognize that safety is not about physical security, but also about nurturing respectful, inclusive cultures that protect the dignity and rights of every learner. This requires strong partnerships between schools, parents, learners, and communities. And this is where we would want to end our presentation, to say these are 3 areas that we felt are very important at this current moment to engage with. Thank you very much, Chairperson.